Now, we will be hearing from Venus Day. After experiencing a rapid loss of eyesight and severe headaches, Venus went to the emergency department and soon found out she had a life-threatening tumor that was crushing her optic nerve. Now, let's hear Venus's story. Now, what a shock that must have been. You were basically going on, leading a normal life, normal sight, everything rolling right along, and then all of a sudden, some tragic event hit and you weren't able to see. Is that right? Tell me what happened.
It was a really big shock. You wake up one morning and your vision starts to disappear. And I just noticed that in my left eye, I couldn't see anymore. And so I went to the ophthalmologist thinking, maybe there's something wrong. Kind of, when your vision goes, you kind of know there's something wrong. Mm-hmm. And he did a bunch of tests and thought maybe it's an allergy because he couldn't find anything wrong with my eye. So he said, well, wait a few days and we'll see what happens. And then next thing I know, the vision starts to disappear in my right eye. Mm. And that's when I went back to the ophthalmologist and we were like, this is no allergy.
And when you were noticing that your eyesight was starting to deteriorate, what were you feeling like? Were you nervous? Were you scared? Were you thinking something's wrong with you? What were you thinking?
I thought, my gosh, is this, I'm going blind? What am I gonna do? Oh my God. And you think to yourself, how would I be a burden on people? And that's the first thing that went through my mind was, I don't want to be a burden on anybody.
Yeah, that's a shame.
Well, it's hard. Well, because, you go through life and you think, I gotta take care of my family. I'm always taking care of other people. Who's gonna take care of them if something happens to me? So that's kind of how it was when I first started. My vision disappeared because I was like, what am I gonna do?
Did you tell your family right away? Were they involved with you during these doctor's visits and trying to see also what they could do to help and what your treatment might be?
Well, it was pretty bad because it was a really big shock for them too, because when I found out, they found out, because when I went to see the ophthalmologist, he was like, I think you might have a tumor. You need to go see a neurologist. And then that evening, that's when I went to Halifax. And that's when they caught the tumor. And they said, you have a Lyme-sized tumor in your head. And boom, you're like, okay, you have to tell everybody, you have to make arrangements, and then you have to you have to turn off your emotions, because you're like, if I have emotions and if I have to be strong, you have to make sure that everybody else is strong so that you can't show any weakness. And so it was really, really tough the first few days finding out, because they had to admit me right away and everything.
It must have been. How long ago were you diagnosed with the tumor?
Believe it or not, just like 4 weeks ago.
Oh my gosh.
And then they operated it, a week later. Yeah.
So they told you they needed to do surgery, right? That was the next step?
Yeah, and they said that you guys had the best surgeons and best doctors in the area. So I was like, knock wood, that was like the best thing. Because, I had no idea. I had no idea where to go. And they were telling me about how Dr. Vinyas was the best surgeon, and all your staff and all the supporting doctors, all the hospitalists that were going to see me and everybody.
And when you came out of the surgery, did you immediately see? What did they tell you? How long did it take before you started seeing differences in your vision?
I guess maybe a day and a half after surgery, I started seeing things that I couldn't see before. It wasn't really clear, but it was bright. And I remembered getting a headache because it was so much for my brain to process. And you spend all this time in the dark, then all of a sudden somebody opens a bright light. You're like, wait a minute, I don't want to look at it. But then I was like, oh, I want to see all this light. But
how long would you say it took from the surgery to the time you pretty much are seeing like you're seeing now?
48 hours.
Wow. So you have the same vision now that you had years before. Is that right?
I couldn't believe it, because when I went to see the ophthalmologist, before I went to Halifax, he was saying that you have 20/20 vision according, because there's nothing wrong with your eyes. You have great eyes. There shouldn't be anything wrong with your eyes, so it has to be some kind of internal problem. So when I got my eyesight back, all of a sudden everything was clear, and I was holding one eye closed and doing this with my other eye and trying to read everything. And next thing I know, I'm reading fine print. And it was just amazing. It's like 20/20 vision again, and I'm like...
That's fantastic. How long were you in the hospital before they released you?
Just a few days. And but what they said was things aren't going to be normal for a while, and it's not normal like the day after surgery, because it's like a kid who goes on a skateboard without having his helmet on. You crack your skull, it's not going to be normal the day after, or a couple of days after, or even a few weeks after, but it takes months because we don't know exactly what the tumor did to my brain beforehand and what, how long it's going to take, but it takes a couple of months to a year before you get everything back.
Do you notice any change since the surgery? Any memory loss? Anything different that you've noticed from before?
I don't remember what food I like. And I look at my clothes and I'm like, did I really buy this off of eBay? I did.
How about same? Any recognition problems? Anything unfamiliar to you that you've noticed?
I mean, I remember people. I remember how I interacted with them, and I asked myself, why did I do that? Why did I treat that person so-and-so, and why did I act like this, and why did I eat that food? And I'm like, because I guess when you come out of the hospital and you have a change of, the tumor's taken out, you kind of feel like, I guess maybe something, the bad part of everything, the thing that holds you back, the thing that judges, the thing that makes you wonder, why did I do some bad things? Why did I treat people? Why did I ever judge anybody? Or why did I ever put somebody down? Or why did I ever think that way when time's pretty darn short and you're supposed to treat everybody? You're supposed to tell them the truth when you have the chance. You're supposed to tell them how much you love them, and each person you meet, you're supposed to treat as if they were, family, your own blood, because you're not supposed to treat somebody disrespectfully or anything.
What do you look back on as like the main reflection that comes to mind when you think back on all this?
There was one thing that happened right after surgery, when out of the blue, and I couldn't even see her, I don't know who she was, but the nurse who took care of me just put a cold, wet cloth on my forehead. Didn't say anything. I didn't ask for it, but it was the one thing I needed, and I didn't know how she knew that. But she put this cloth on my forehead, and I just knew I was going to be okay, and it felt so good. And she just knew.
It's amazing how things like that stick out in your mind, isn't it? Little things mean a lot, don't they?